Hello, and welcome to this ethical dilemma in science. I'm John Hoffman, a professor of biology at Arcadia University in Pennsylvania. These scenarios in this collection examine a potentially controversial science-related topic in order to better understand the basic science concepts involved in the associated ethical debates. The goal is not to decide upon a final concrete and universal decision about the use of science or technology, but to stimulate a discussion considering the different viewpoints in order to better understand the views of others. In this ethical dilemma in science, we will examine responsible conduct in research, focused on the question, how research misconduct harms scientific progress and public trust. Now, the responsible conduct and research policies within the United States were implemented in response to a series of high-profile cases of misconduct in the 1970s and the 1980s. This led to congressional hearings led in the early 80s by Representative Al Gore and later in the 80s by David Dingell. As much of the research funding comes from federal government funds, Congress has an oversight into how those funds are used. However, it appears as if the political atmosphere and the news coverage for these hearings may have grossly exaggerated the scientific fraud. However, the results of these hearings and subsequent lawmaking resulted in the creation of offices of research integrity. Associated with this was the creation of a federal misconduct policy that required all research institutions to provide training in responsible conduct of research to all those researchers receiving federal funds. Ultimately, this resulted in a definition of research misconduct, which according to the US government is defined as fabrication, falsification, or plagiarism in proposing, performing, or reviewing research or in reporting research results. It also provided guidelines for investigating and reporting misconduct, as well as a legal threshold for proving the charges of misconduct. In addition, it provides guidelines for the protection of both the whistleblower that brings these concerns to light, as well as the accused during the investigation and adjudication of the findings. Now, it's important to realize that a finding of research misconduct requires three things. The first is that there be a significant departure from accepted practices of the relevant research community. The second is that the misconduct needs to be committed intentionally or knowingly or recklessly. And then finally, again, related to that legal threshold for proving charges of misconduct, the allegation must be proved by a preponderance of evidence. If we look at these definitions of scientific misconduct in a little bit more detail, what we can see is that fabrication is the making up of data or results and or making up the recording or reporting of them. Falsification is defined as manipulating research materials, equipment, or processes, or changing or omitting data or results such that the research is not accurately represented in the research record. And then finally, plagiarism is the appropriation of another person's ideas, processes, results, or words without giving appropriate credit. Now, associated with these policies involved with responsible conduct in research and research misconduct, there have been a variety of penalties put in place for proven cases of research misconduct. Overall, this could result in the end of a researcher's scientific career. Now, prior to the implementation of government policies on responsible conduct in research, it was up to the institution to make the decision to investigate and adjudicate any claims of research misconduct. Now, we see that there's an opportunity for this investigation to occur still at the research institution level. And within the institution, it could result in the termination of a researcher's employment. So basically, they could lose their job, or a requirement that the researcher undergo supervision for projects for a period of time. At the government funding levels, they have the opportunity to prohibit those found guilty of having committed misconduct from receiving federal research funds for a period of time. Now, normally this is for a period of several years, but in egregious cases, it could result in a permanent banning of that individual from receiving federal research funds. At the scientific community level, there are also penalties for scientific misconduct in the form of the need to correct the scientific record. And so this can occur with kind of minor corrections in the form of errata published by the journals, or in the case of very severe instances of research misconduct, this could result in the formal retraction of the paper, so the removal of the paper from the formal published record. Now, taking a look at this and the policies and the newspaper accounts and the government hearings and congressional hearings, it appeared as if there were, lots of examples of scientific fraud, scientific misconduct. And so if we take a look at the most recent statistics that are available, what we can see is that a National Science Foundation report covering the period from May 2020 to April 2021 indicated that there were 51 allegations of research misconduct. And of those, the majority, roughly 2/3 of them, were associated with incidences of plagiarism or intellectual theft. Similarly, the Health and Human Services, another major agency within the US government providing funding for scientific research, at the end of fiscal year 2020, they had closed 45 cases associated with scientific misconduct. Of those 45, over half they declined to pursue because there wasn't enough evidence or enough of a claim to indicate that there was a need to proceed. Of the remaining 19 cases, 8 resulted in a finding of no research misconduct. So for the period of time for fiscal year 2020 in the funding agency of the Health and Human Services, there were 11 cases of proven research misconduct. So we can see that it's relatively small. Within the scientific journal community, a number of editors and a number of researchers have looked at scientific misconduct, looking at it in relationship to the number of articles that have been published, in relationship to the number of articles that are retracted, and they estimate that misconduct is relatively rare, occurring on the range of about 1% to 2% of the time. So to look at an example of a very controversial paper with a troubled history associated with it, we're going to take a look at the 1998 paper that reported that the MMR vaccine, the measles, mumps, and rubella, three vaccines combined in one, was linked to a bowel disorder and a severe form of regressive behavior. In the study, it was conducted within the UK. They were looking at the measles, mumps, rubella vaccine, which had been in use in the United States since 1971, but was introduced into the United Kingdom in 1988. Now, this MMR vaccine replaced a single vaccine for measles and basically combined the vaccines for all 3 of these diseases into a single one. And from the perspective of measles, it used a live but weakened, the scientific term for it, attenuated virus. Now, in this 1998 paper, the researchers reported the findings from 12 children that they indicated had normal development that was followed by a loss of acquired skills, including the loss of the ability to communicate, the loss of language, together with diarrhea and abdominal pain. Now, in 8 of the 12 cases, roughly 2 out of the 3 cases, that were 2/3 of the cases they looked at, the onset of these behavioral symptoms, both the loss of the acquired skills and the abdominal disorders, were associated with the MMR vaccination by the parents. basically reported, parents reporting that their children's behavior had changed very dramatically within a short period of time, in some cases less than a week after the vaccination. At a press conference that the medical school held after the publishing of this paper in 1998, the dean of the medical school urged caution on the implications of these results because they were based on 12 students. But the primary author of the study, Andrew Wakefield, urges the use of a single vaccine instead of this tri-virus MMR vaccine until more information was available. Now, these were very serious claims, and so the scientific community responded quickly to look for links between the MMR vaccine and autism. Within weeks, the Medical Research Council of the United Kingdom brought together experts to review evidence, and they basically determined that there was no link between the MMR vaccine and autism, or between the MMR vaccine and this inflammatory bowel disease. In addition, a study published very soon after that, conducted on the vaccination program within Finland, looking at 1.8 million vaccinated individuals, so roughly 3 million vaccinations, because it is generally given as a 2-vaccine regimen. Over the period of time, 14 years from 1982 to 1996, looking at this 1.8 million individuals, they could find no evidence for a link between the MMR vaccine and either the inflammatory bowel disease or autism. So this gives rise to a series of ethical questions. After further investigation by an investigative journalist in Great Britain, investigations by the medical school, it was determined that the lead author in the study, Wakefield, received £55,000 from the Legal Aid Board to investigate a link between MMR and autism. And so basically in the United Kingdom, the Legal Aid Board provides funds to individuals that, or at least it appears as if the Legal Aid Board is providing funds to individuals to determine if they have the potential to bring a lawsuit against somebody for damages. In addition to that, Wakefield was hired by a lawyer representing some of these families to gather evidence about the MMR vaccine for a potential lawsuit. In addition to that, and it didn't come out at that time, Wakefield during this period of time was also attempting to patent his own single-shot measles vaccine. And so when this information came out, an investigation by the hospital system where the study was conducted indicated that these instances of funding should have been disclosed prior to the onset of the study. They should have been disclosed with the publication of the studies so that others were aware of the potential of a conflict. Now, as a result of this information, and again, the hospital found no evidence of misconduct, but indicated that these potential financial interests should have been disclosed. 11 of the 13 original authors that were able to reach 12 of the authors, 10 of the 12 authors that they reached issued a partial retraction of the interpretation of a causal link between the MMR vaccine and autism. And so that's a finding that wasn't actually in the study itself. It was implied within the study and came out in the news conference. But that gives rise to our first ethical dilemma. Does a financial interest in the outcome of the study result in a potential bias or a potential conflict of interest? Now, there were continued concerns about this study and the implications associated with it. So the United Kingdom General Medical Council, this is a council that oversees the practice of medicine within the United Kingdom, launched a very large investigation that overall lasted a period of time from 2007 to 2010, in which they kind of reviewed the records, they interviewed witnesses, they interviewed researchers associated with the study, and they found a number of findings. Included within the findings were that the subject recruitment was not described or as described in the paper was misleading. Within the paper, they said that they had been referred to the clinic and therefore they were recruited from that. But at least half of the families that brought children into the study were involved with the potential lawsuit against the MMR vaccine manufacturer. There were ethical concerns that were raised that were, again, challenged by the researchers in the study. But the ethical issues were that children may have been subjected to invasive procedures like a colonoscopy that were not warranted by the medical condition that they had. Furthermore, the lead pathologist on the study reviewed the departmental records and the notes from the study and found minimal or no changes within the subjects, even though the paper, the reported 1998 paper, reported colitis, inflammation of the digestive system in 11 of the 12 subjects, and swollen glands in the small intestines of 10. So it was unable to find data that supported the results or conclusion. An external GI pathologist was brought in and reviewed slides of the biopsy samples that they collected. And that external GI pathologist indicated that in their view, 8 of the 11 children reviewed were normal. So as a result of this, the UK General Medical Council stated in their conclusions that the lead author abused his position of trust and brought the medical profession into disrepute. And in doing so, they struck Edward Wakefield from the UK Medical Registry, which basically prohibited him from being able to practice medicine in the United Kingdom. At this time, the Wakefield 1998 paper, which has been used to show a link between the MMR vaccine and autism, was fully retracted by the Lancet editors in 2010. Lancet editor Richard Horton stated at that time that it was utterly clear, without any ambiguity at all, that the statements in this paper were utterly false. Furthermore, he went on to say, "I feel I was deceived." And in the kind of retraction statement illustrated on the slide right here, it's a relatively short thing, raises the claims that the recruitment of the children was kind of random, since they were recruited by essentially the lawyer, but involved with a potential lawsuit, concerns about the ethical procedures that the children were put through, but they fully retracted this paper, as well as stating statements within this. Several elements of the paper are incorrect, contrary to that earlier investigation conducted by the hospital system. So that gives rise to our second ethical dilemma. And so, does a strong concern about the safety of the triple MMR vaccine represent a hypothesis that needs to be tested, or a pre-existing bias which potentially limits the ability of the researcher to be objective in looking at the results? Now, the lead author in this study wrote to the United Kingdom's chief medical officer prior to the start of the study, raising concerns about the intent to revaccinate preschool children, to basically use this vaccine to treat additional children during this period of time. And so, is this a hypothesis, or is this potentially a pre-existing bias? Our third ethical dilemma: could Wakefield be considered a whistleblower for raising concerns about the safety of the MMR vaccine? Wakefield, even to this day, continues to claim that he was silenced by the British establishment for exposing the truth. And at that press conference in 1998, where they talked about the results of their studies, he indicated that it's a moral issue, and I can't support the continued use of these 3 vaccines given in combination until this issue has been resolved. Again, indicating his concern for the use of this trivalent or 3 antivirus agents within this vaccine. So like in other ethical dilemmas in science, opportunity to pause here for discussion and then come back for a little bit of additional information. So just as a follow-up, taking a look at a paper published in 2014, again, looking at the evidence and attempting to understand, is there any possible link between vaccines and autism? And as a result of this study, which looked at other published studies, they were able to demonstrate that vaccines are not associated with autism. And in this, they looked at 5 cohort studies that examined the records of over 1.2 million children, in which case they found no relationship between autism and the MMR vaccine, between autism and mercury, or autism and thimerosal. Now, thimerosal is a preservative used to prevent the growth of bacteria in a multi-dose vial. There are instances of rare allergic reactions, but the form of mercury within thimerosal breaks down relatively quickly within the body, and it is very, very different from the other form of mercury, methylmercury, that accumulates in fish and is toxic. Even though it appears safe, thimerosal was taken out of childhood vaccines in the United States in 2001. Now, if we take a look at these studies, over 1 million children were looked at. The Finland study also had over 1 million people looking at it. Keep in mind that the Wakefield 1998 paper was based on 12 children, and at least half of the parents of those 12 children were involved with a court case against, or potentially involved with a court case against a drug company, of which Wakefield was being paid as an expert witness in the development of this. And this gives rise to our final ethical dilemma in science for this topic. How do we ensure that retracted, inaccurate science does not continue to mislead? And so this is looking, again, because the study was done in the United Kingdom, we're looking at vaccination rates within England, within the United Kingdom. The World Health Organization kind of recommends that the vaccination rate for measles ideally be in the range of about 95% in order to have herd immunity, so that those individuals that are not able to be vaccinated can be prevented from the spread of the disease by those that are. And what we can see is that even though the vaccination rate was going up after the introduction of the vaccine very early on in the 80s and mid 80s, after the publishing of this paper, we can see a drop in the vaccination rate well below that 95% target established by the World Health Organization, which was associated with additional outbreaks of measles within the country. Now, as a result of concerns associated with the MMR vaccine, we're seeing that measles is becoming endemic again in a number of countries after it had been eliminated earlier. And in 2019, the United Kingdom lost its measles-free status with the World Health Organization. And so the final ethical dilemma that I have for you today is, how do we ensure that this retracted, inaccurate science does not continue to mislead? You can still find references to the Wakefield 1998 paper being used as evidence against vaccinations. So thank you for visiting this ethical dilemma in science. There's additional information as well as additional readings in the text description below. So thank you and have a great day.